I'm Dr. Sanjay Panicker. I'm the founder and managing director of Amrita Homeopathy. We are present in 3 locations in Bangalore at Koramangala, Marathali, and Electronic City. Nowadays, we find a lot of kids with learning disabilities, especially post COVID. During the COVID times, when all the children were indoors, we see that most of the kids born during that period are having some or the other learning disability. The most common learning disorders that we find in kids is inability to read, inability to write, inability to socialize, inability to do calculations, and inability to concentrate. Most people come and tell me that my child is not able to concentrate. One of the reasons when the child is not able to concentrate could be that the child is focused into something else. But nowadays, because of excessive screen time, children are most often on their mobiles or watching TVs. During COVID, this is what happened. The children lost their ability to grasp and learn from the surroundings. Their attention is diverted to various things. They're not able to focus their attention, and that's where we see a lot of kids coming up with ADHD, attention deficit hyperactivity disorder. And we also find kids having autism. Sometimes even the milestones start reversing. The children who started talking, started walking, suddenly stop talking, suddenly stop walking, and their milestones are reversing. This is all a feature of due to the ability to learn various things. These learning disability is what has come as a consequence of excessive screen time, less involvement with the family, less involvement with other kids. So the best thing to do in this is start connecting back with the kids, spend more time with them, encourage them to do what they like to do. Whenever you find any positive things in the child, tell them how good it is for them to do that. Be with them, try to understand what their problems are, try to understand what the others are expecting out of the kids and where the kids are under pressure, and try to support them in that. Sit with them and do their homework, take them out to play with the other kids, and let them start interacting with the other kids. Interaction is where they start developing their ability to communicate. The ability to communicate, the ability to learn things has to happen in the form of games. And nowadays, in many schools, they have started integrating techniques where the children are not learning directly from the books, not that parrot type of learning, but instead they interact, they tell them stories, give them activities, and they learn from that, isn't it? So that's what the child has to have, not learn from the screen. Many times nowadays kids have an accent. They have an American accent in their speaking because they have been seeing cartoons with the cartoon characters speak in a particular accent, and the kid learns those things rather than interacting with their parents and grandparents and learning the way how they are reacting to different situations. That would be what is to be encouraged in the kids, where they start interacting with living people than with the screen. So that will bring about a lot of change. If the severity of the issue is too high, take medical help, where there are therapists who can guide the child with behavioral therapies, speech therapies, cognitive therapies. There are various things like this where the children can learn. Integrate that with homeopathic system, with homeopathic medicines. When you integrate that, these therapies along with the homeopathic medicines, children respond excellently. For example, I had a patient in Germany who used to take treatment from me online. We were consulted only online because they were there. But the child responded so well. Initially, there was no eye contact. The child used to never look at me when I tried to connect with the child on the screen when we did on-call consultation. But later, with treatment, the child sitting whatever questions I asked, the child started responding back to my questions, and the parents said there's a lot of change, and he's talking, he's communicating with other kids, he started learning, he started sitting to learn, all those things. Otherwise he was just roaming around and making sounds and all that. So all autistic traits. But with time things changed with homeopathic medicine. There are excellent medicines like stramonium, tarentula, tuberculinum, calcaria, lycopodium, sulfur. But which medicine to give? It's better to talk to a physician. The physician, this is very intricate, something dealing with your brain and its development. So do not self-prescribe for this. Take a homeopathic doctor's help and he'll be able to help you in dealing with this. One additional thing is that never ever put down the child in front of others, even if the child is wrong. Maybe you can talk to the child separately about it. but never compare the child with certain other children. Encourage them whenever they are doing something right and tell them that is what they should be doing in this particular situation. So encourage their strengths, encourage the positive things that they do. Don't focus too much on the negative. Corrections and therapies can be done by the therapist. Correction of this particular problem of concentration or inability to learn can be done with the help of homeopathic medicines. And with this combination of integrating therapies with homeopathy and correct parenting, the child can come back to a normal situation. It's not any irreversible problem for you to worry about.